Hi, I'm Dr. Powell. I'm one of the OB hospitalists here at Reston Hospital Center, and I'm just going to go over a couple of basic discharge instructions that we tell all of our postpartum moms, whether you've had a vaginal delivery or a cesarean section. So some will be specific to just having had a vaginal delivery, and others obviously specific to those women who've had a C-section. For most women, we say that the recovery from postpartum takes about 6 weeks. So you can have these symptoms coming and going intermittently throughout that 6-week period. You always have your OB physician to call, and I'll go over some of the parameters for when you should give them a call to get more advice as to whether or not you need to be evaluated by your doctor. For a vaginal delivery, we recommend having these sitz baths. This is a way to help soothe your bottom, your perineal area, and you can begin anytime after 24 hours after delivery. You can take one home with you from the hospital and use it for about 10 to 15 minutes, anywhere up to 3 times a day as needed. Text pad and numbing spray can also be used, and these will be provided to you prior to you going home. And this can help ease some of the discomfort from any tears or any hemorrhoids that you may have experienced. Showering is recommended for both vaginal and cesarean deliveries, and any stitches for vaginal deliveries will dissolve on their own, and for a C-section, you want to keep the abdomen area over the incision clean and dry, and you can shower and let the warm water and soap run down over your incision. And once you come out of the shower, we recommend that you pat it nice and dry. And if you had a cesarean section, you may have steri strips, which are, I always say, like very sticky band-aids. And they usually start to peel or come off on their own after about 1 to 2 weeks. But if you notice that they're starting to peel or they're looking a little bit dirty, you can certainly go ahead and take them off. Like I said, they're just very sticky band-aids. You also take care not to scrub in that area. Like I said, just let the warm water and soap run down over the incision when you are in the shower. Get plenty of rest and sleep when the baby is sleeping, and have a high fiber diet if you can, with fresh fruits and vegetables, and drink plenty of water each day. Empty your bladder and change your sanitary pad every few hours or as needed. Continue taking your prenatal vitamins for as long as you are breastfeeding, and any medications that your obstetrician recommended. If you are constipated or struggling to have a bowel movement, which is very common, Colace or Senacote are available over the counter and certainly can be used to help facilitate a bowel movement. You can expect to bleed for up to 6 weeks, though most women do tend not to bleed for that long, but we do say up to 6 weeks is very normal. And the color and the consistency will change during that time frame. Any increase in your activity, you could see increase in bleeding, and of course if you are breastfeeding, you might notice more cramping and bleeding after you finish breastfeeding. We do not recommend sex or anything in the vagina, tampons, the Diva cups for at least 6 weeks, or unless you've seen your obstetrician and they've cleared you. Walking and exercise is great and definitely recommended to help improve your mood, as well as getting your GI system back to normal. For C-section specifically, if you've had a C-section, we do not recommend lifting anything heavier than the baby, and no strenuous exercise until you have your visit with your obstetrician and they've cleared you for more vigorous exercise. Your obstetrician will also let you know when it's safe to drive, especially if you're still taking any narcotics. That is not recommended. Physical therapy instructions as well will be provided to you prior to your discharge, and a follow-up appointment with your obstetrician as indicated by your obstetrician, which can be as early as 1 to 2 weeks after your discharge, and up to 4 to 6 weeks postpartum. Mental health, it's very important to monitor how you're feeling. It is very normal to have a roller coaster of emotions after a delivery and in the postpartum period. The first 1 to 2 weeks You're feeling not quite like yourself, that's very normal, and it's called the baby blues. And after about 2 weeks, if the things that used to make you happy are no longer, or you are not feel like doing the things that used to make you happy, or don't feel like taking care of yourself or your baby, please call your doctor right away. And a couple of other reasons to call your doctor: if you have heavy bleeding from the vagina, which we consider as soaking through more than a pad in at least an hour for more than 2 hours, to call your obstetrician, or passing large clots larger than the size of a golf ball. A temperature of a greater than 100.4, or any flu-like symptoms, pain, redness, warmth, swelling, a foul-smelling discharge, or odor around the incision or around the perineum. We recommend that you call your obstetrician. Severe headaches or blurred vision, trouble breathing, faintness, dizziness, and sharp pains in your chest, abdomen, or breasts, pain or burning, warmth, tenderness in your lower extremities is also a reason to give your physician a call. Thoughts, and most importantly, thoughts of harming yourself or your baby, please call your obstetrician. Great, and thank you. I know this was a lot of instructions, but it's not all inclusive, and so if you are feeling anything that's concerning or have any questions, your obstetrician is always available, and you can give them a call, and they can address your questions. We wish you all the best, and thanks for choosing Reston Hospital Center.
Good morning, I'm Dr. Perry. I'm one of the pediatricians from Children's National, and I'm here to review a few basic instructions for going home with your well newborn infant. First of all, congratulations. This is one of the most exciting things that will ever happen to you, and wish you a lot of luck as you're headed home. First, I just want to talk about a couple of things that you can expect normally with every newborn infant. First, feeding. So the only appropriate foods for a newborn baby to be eating is breast milk or formula. Normally, babies will feed every 2 to 3 hours for breastfed infants, or 3 to 4 hours for formula-fed infants. What we expect is that a baby will wake up to eat between every 2 to 4 hours. If you find that a baby is sleeping for longer than 3 to 4 hours, it's a good idea to wake up your baby to feed them. Once babies have regained their birth weight and they're feeding well and gaining well, and you've established that with your pediatrician, then it's okay for babies to sleep a little bit longer between 2 feedings. But for those first couple of weeks, it's important that they're feeding just every couple of hours. For newborn sleeping, they sleep a lot. So it's really common that babies may only be awake while they're feeding, and then for a brief period of time to look and interact with you. A great thing to do with your baby when they're awake and their eyes are open in that quiet alert period is to be holding them just about this far away from your face and talk to them. You can talk to them about anything, the weather, the news, whatever is on your mind. But they just love to look at mom and dad's face, or any caregiver, and this is about as far away as their eyes can see really well. It's common for babies to have some spitting up after feeding. After a feed, you can gently burp your baby. You can hold them upright, pat them on their back, hold them up over the shoulder, and give them some firm pats. But it's really common that they may spit up small amounts. Some babies spit up after every feed, and some pretty rarely. If your baby is having a forceful projectile vomit, or if the vomit ever has anything like blood or green material in it, it's important to call your doctor. When we think about putting our babies to sleep, we want to make sure that they're swaddled well in a blanket. They can use either a blanket that's tightly swaddled around their body, or one of the commercially available swaddling blankets. It's important that their hips are free so that their legs can move up and down. And most babies do better with their arms swaddled, although some babies just prefer for their arms to be free, and that's okay too. But what's really important is that babies are always put to sleep on their back. We know that babies who are sleeping on their sides or on their bellies are more at risk for sudden infant death syndrome or suffocation. And that once we started recommending all babies sleep on their backs, the rate of sudden infant death syndrome dropped by 50%. It's also important that babies are sleeping on a firm surface like a crib, pack and play, and flat. We don't recommend any wedges or positioners. Those all can pose a risk for infant suffocation. It's great for babies to be in the same room with mom and dad, especially for the first 6 months, but not great to be in the same bed. So right next to the bed and a crib, bassinet, pack and play is great, but in the same bed is a risk. In terms of diapering, babies usually we expect after the first couple of days them to make wet diapers pretty frequently, 5 to 8 a day. And then for their bowel movements, some babies will have bowel movements multiple times a day. Others may go days in between bowel movements after the first couple of weeks of life. Both are normal as long as the stool isn't either pure watery or small, hard pellet-like balls. Now I'd like to talk about a few items that are pertaining to your infant's safety. The most common safety piece of equipment that you'll be coming into contact with is your baby's car seat. Remember that in the state of Virginia, all children should be in a rear-facing car seat in the back seat of a car until they're at least 2 years of age, and ideally longer until they outgrow the weight and height requirements for their car seat. Being rear-facing in the back seat of a car seat is the safest place for anyone to be. When you have your newborn in your car seat, ideally you want that chest clip to be right up in the middle of the chest so that if you stroke the right above the top of the car seat, you're coming right armpit to armpit. You don't want the chest clip to be too high up near the baby's neck or too low down near those soft belly organs. You want it right up here and snug and secure. You should be able to fit about 1 finger underneath the chest clip. That's how you know that the car seat is snug enough, but not 2 fingers. That would mean that the car seat was too loose. In the winter time, it's better for baby to be wearing thin layers under the straps, and then a warm blanket on top when you're out of the car, because thick clothing under the car seat can make the straps not secure enough in the event that the car seat is needed. When your baby is out of the, when your car seat is out of the car, just remember never to put that car seat on anything, elevated. If it's not in the car seat, it should be on the ground, but not on a high surface. This is really true of your infant when they're not in the car seat as well. Don't put your infant, on a bed or a couch. You'd be surprised at how even the smallest infant can wiggle themselves to a place where they can fall off of a high surface. So never have your infant unattended on any surface that's above the ground. A few other things for safety. Remember that every home should have working smoke and carbon monoxide detectors. Don't forget to check those batteries every 6 months to make sure that safety equipment is working in your home. Make sure that your water heater temperature is set at 120 degrees so that there's no inadvertent burns of your infant. And keep in mind that when you're holding your infant, not to be drinking any, hot beverages like hot coffee or tea, or eating hot soup. This can lead to inadvertent burns. And then as your child becomes older, don't let any hot items be unattended where they could be grabbed, pulled down, or lead to burns in that way. Keep in mind that if there is smoke exposure around a baby, either someone smoking in the same room or secondhand smoke, like someone who's smoked and then come inside and picked up the baby, all of that smoke exposure for an infant can lead to problems like increased colds, reflux, and it also unfortunately can lead to an increase in sudden infant death syndrome. So it's really important that no one smokes around the baby, and that if anyone smokes, that they change their clothes, wash their hands before handling a baby. Also keep in mind that babies should never be shaken. If you're feeling frustrated, having a tough day, baby's crying a lot, colicky, fussy, upset, it's better for a baby to be safely crying in a crib while you take a mental health break in another room, get your breath, call a friend, call a caregiver, someone else who can, give you just a little bit of break. That's really important because it can be hard to take care of babies who are crying, fussy, and upset, but really important for their safety that they're never, shaken or handled. Much safer to be in their crib while you take a break somewhere else. Last, I'd like to cover a few reasons why you should call your child's doctor. Remember that in the first 6 weeks of life, a fever is an emergency for a newborn. For newborns, a fever is a temperature of 100.4 or higher. And the most accurate way to take a newborn's temperature is rectally with a rectal thermometer. I recommend you keep one thermometer in your home exclusively for the use of taking rectal temperatures when needed. You don't need to take your baby's temperature on a regular basis. You should only check it if you're concerned. And reasons to be concerned would be your infant feels warm, your infant is very fussy or difficult to console by the usual methods like feeding, rocking, swaddling, or your common soothing methods, or if your infant is very sleepy, sleeping through more than one feed, difficult to wake up, feeding poorly. Those would all be reasons to check a baby's temperature. Keep in mind that a low temperature is also of concern, so a temperature less than 97 you would want to seek care for. You may call your pediatrician with that low or high temperature, or you can just bring your baby to the emergency room because any of those high or low temperatures need to be checked out right away by a doctor. We don't recommend that you give Tylenol or ibuprofen or any fever-reducing medicines to a newborn less than 6 weeks until you've been seen by your physician. Other things to watch out for in a newborn. If your baby is becoming more yellow in skin color, they're feeding poorly, or they're not making good wet or poop diapers, this could be signs of jaundice. That's something that you should see your pediatrician for. Also, if your baby is having new symptoms that they weren't having before. So remember that it's common in babies to have sneezing, nasal congestion, especially after feeding, hiccups. It's also common for babies to have small amounts of spit up that look like the formula or the milk that they're drinking. But it's not normal for a baby to be having increasing nasal congestion and discharge, coughing, profuse vomiting, especially any vomit that has a green color or blood. Those are all reasons that you should see your baby's doctor right away. Other things to be wary of in newborns include if your baby is feeding poorly, they're not having a good vigorous suck, or they're falling asleep right away, or if they're having unusual movements or they're stiff. Certainly if a baby ever appears to be having trouble breathing, fast breathing or hard breathing where their nose is flaring, they're sucking in the neck or under the ribs, that's a sign that baby may be having some difficulty breathing and a reason to see the doctor. Remember that the list of things to do with a newborn is fairly short. They need to be fed, they need to be loved, snuggled and cared for, they need to be changed. You can do some tummy time with your baby. If you just put them flat on a surface, that's a lot of hard work for them, but I encourage you to be in a reclined position and have baby on your chest. That gives them a little bit of practice picking up their head, turning around, and will help them build up that strength for that first big motor skill where they get their selves up on their elbows with their head looking around. So remember that although the work is hard, there's not too much to do right at the beginning. Here at Reston, we're so glad you chose us. Thank you so much. Have a wonderful time with your baby and good luck.
Hi, I'm Peggy. I'm one of the lactation consultants here at Reston Hospital. I'm just going to go over some information that you might find useful once you get discharged from the hospital. So while you're in the hospital, hopefully you've gotten some assistance with feeding your baby from the nurses or lactation consultants. And then once you go home, some of the things that you can expect to happen. For most people, they don't get their milk, what we call get your milk in while you're here in the hospital. So in the next day or two after you go home, you may find that your milk supply has increased. For some people, that may bring some tenderness or discomfort and what we call engorgement. And so before you go home, you can ask for some information in regards to how to manage engorgement. Some things like massage, cold compress, make sure you're feeding the baby on demand. If there's any trouble with latching, you can also make sure that you're pumping to be sure that you're emptying your breast frequently to provide comfort and also to make sure you're maintaining your milk supply. So again, milk supply can be expected in 1 to 2, possibly even 3 days after discharge, depending on when you go home. Your baby's feeding frequency. At that point, once you go home, your baby needs to be eating at least 8 times every 24 hours. How that's distributed can be different with each baby. Some babies will cluster feed, meaning they'll feed, maybe every hour for a few hours, and then maybe they'll sleep a little bit longer. But regardless, in 24 hours, there needs to be at least 8 feedings. A common question that I get is, how do I know that my baby's eating enough? So tracking diapers is a very useful way to tell if your baby's getting enough. Whether you're bottle feeding or using formula or breast milk or some kind of combination of feeding, it's important to make sure that your baby's getting enough. So whatever comes in, theoretically, whatever comes in should come out. So there will be a chart that's given to you when you are admitted to the postpartum floor, and it goes over, we expect on the first day of life 1 wet diaper and 1 poop diaper, and so on. And then by the end of the week, it lets you know what to expect. If at any time your baby's diapers are not meeting those minimum requirements, that may be an indication that they're not getting enough to eat, and you can certainly talk to your pediatrician or contact outpatient lactation to get some assistance with that. If you are experiencing any kind of sore nipples, also contacting a lactation consultant to get immediate help with that, versus waiting for, maybe I can figure this out and make it better. It can just prolong an uncomfortable situation and possibly put you at risk for things like mastitis. So that's one other thing to look out for, is if you're noticing any flu-like symptoms, fever, body aches, or even like red streaking, or like areas on your breast that feel painful and they're red, that could be a sign of mastitis, and you need to contact your doctor about that.